So how can we learn to skillfully deal both with big and small traumas in the most constructive way possible? Well, that's where Dr. Keith Witt comes in. Keith is a psychologist who has conducted over 75,000 therapy sessions, published 10 books, and given 3 TEDx talks. Keith also regularly releases videos and podcasts in which he shares his professional insights about a variety of topics, including trauma. And in the following clip, Keith starts by sharing his definition of trauma.
You can look at trauma best as seeing a polarity between resilience memories and trauma memories. So resilience is something difficult happens, we struggle with it, get through to the other side, and we're a little bit wiser and stronger. This is how we're designed to be. And this is how we grow. A certain amount of stress met causes us to get stronger. But then, because if you're doing that, there's going to be some stresses that you don't successfully navigate. And then that tends to sensitize us. What's sensitization? Sensitization is that there's a trigger that causes distress. And as you move forward through time, it requires less and less of a trigger to create more and more of a distressed response. And those are trauma memories. And everybody has them. Everybody has had major traumas, big T traumas, they're called in EMDR by Francine Shapiro, or in little T traumas, just the little frustrations of life. And so as our personality develops and as we move through the world, we become more resilient dealing with stuff. And sometimes we get trauma learning. Sometimes in an extreme sense, PTSD, post-traumatic stress reaction, is an extreme sense. When there's chronic childhood trauma or some big event, we'll have instantaneous learning where some trigger will send us into physiological responses, panic attacks, that kind of stuff. Images. The memories and images from PTSD are different from other kinds of memories. They're more shocking, more urgent, more debilitating. So that's humanity. That's all of us. That's all of us growing. And by the way, that doesn't happen alone. Trauma tends to happen in contact with other people. Resilience tends to happen with other people. Healing trauma tends to happen in relationship with other people. And one of the characteristics of trauma memories, interestingly, is that they separate us. There's a subjective sense of separation from other people. And so trauma and resilience are forms of memory that we all have and that we all need to deal with for better or worse.